Hello all, welcome to another episode of WHF Talks.Live. This month we are featuring innovation as a theme, and I am today joined by Mr. Bernardo Mariano, Chief Information Officer and Director of Digital Health and Innovation at World Health Organization. Welcome, Bernardo. It's such a pleasure to have you with us today.
Thank you, Farah. Thank you. Happy to be here.
The circumstances are challenging, and there must be quite a lot of pressure due to COVID-19. So let's start with a hot topic. How has COVID-19 affected digital health and innovation?
It's affected in two ways. One was the challenges that it brought to all of us in terms of how do we adapt to new ways of working, new lifestyle, and new all the restrictions in terms of family and the social interaction. But also it brought opportunities, especially in using digital technologies to overcome some of the challenges that we faced. But also, most importantly, I think it brought the realization that digital technologies for health can actually be accelerated, but also ensure that it brings those benefits that we all need. Just to give you just one example out of that is telemedicine. If we had policies that would allow the wide use of telemedicine within European region or even around the world, these challenges we saw with the health systems collapsing in many developed countries would actually be minimized, let alone the fact that a lot of people that have the non-communicable diseases that are not COVID related could not have access healthcare services. So that's the opportunity, and that's what we hope, and we are working with a number of countries to leverage on that to address policy changes, regulations, to really maximize the access and the use of digital technologies for better health and well-being.
Thank you so much. In 2019, the digital health market was worth $86 billion, and it is forecasted that this will increase to about $300 billion. How has WHO aimed to work with partners in the private sector to advance this sector and to improve the health of people globally?
Let me start by saying that with this more than threefold increase, we want to see a sixfold increase in terms of access. So not just how digital health is worth in terms of the market worth. We want to see access to increase at least double, but also, the hope is that those communities that are not accessible by digital technologies are not forgotten. You and me, we are privileged to actually be able to leverage from digital technology when it's available. But they are 47% of the world that do not have access to broadband. So we want to also see that we leave no one behind within that spirit of the Sustainable Development Goals that we all sign up to. Now, in terms of how can we see this $300 billion net worth or worth of digital health to improve health and people globally? First of all, we released the global strategy on digital health, which has 4 fundamental principles that we hope that we all adhere to and all can be signed off for that. One is that we need to institutionalize at national level. And we need that commitment from countries to institutionalize at national level, that the digital health is part of health strategy, national health strategy, which also brings those, ensure that we accelerate those positive health outcomes. Second, successful digital health initiatives requires integrated strategy. The healthcare sector is siloed. We need to break the silos. We need to make sure that by breaking the silos, we then are able to leverage on digital technology such as artificial intelligence to really bring those positive health outcomes and the impact we all want to see at primary healthcare and all other levels. Third, let's promote the appropriate use. we are in the space where health and life science and digital technology or tech giants are in two extremes of the or in the same perspective. One, health and life science thrives on donating blood, donating organs, donations. We donate something to save somebody. And the digital and the tech giants, they are in the business of making money out of data. So we want to make sure that we use that innovation drive from the tech giants, but we also use the key principles of health and life science to create innovations that will achieve and accelerate in the appropriate use of digital technologies for health for all. Of course, let's not forget the least and middle income countries. They have their own needs. They have priorities that they have to juggle with. Is it food security? Is it digital technologies? So how can we make sure that within the whole the equation of transformation of the healthcare through digital, we address those impediments that least and middle income countries have. So innovation needs to drive within those four key principles.
Thank you, Bernardo. Very good point indeed. Digital divide, leaving no one behind. There are definitely so many things we need to consider with the impact of COVID-19. And I think before it was there, and COVID-19 kind of helped us to understand that there is this thing happening. So very good points and very good comments. Thank you so much. And you mentioned about technology, tech giants, technology companies. One issue to be considered is to do with the responsibility of these big tech companies. They have a massive role to play for the SDGs. However, many of the technical solutions they provide are often too expensive or complicated for small to medium-sized NGOs or organizations to implement. How do you see the future and the present role of technology companies in our aim to achieve the SDGs?
Without private sector engagement, and without, of course, the whole collaboration of non-profit public services and as well the private sector, without really working together, we will not achieve the SDGs that we all sign up for. So the question here is, how can we ensure that as tools are developed, we promote also open sources that will allow countries that cannot afford to pay a license to the large tech giants to have these systems to really leverage on those technologies to develop solutions or to improve health coverage or to improve health delivery services. So it is important that in addition to the social obligations of these large tech companies, because we have to understand that without profit, the private sector cannot survive. But also we have to also recognize that we cannot promote profit at the expenses of everyone, even doing harm, because there's the other principle in health: do not harm, because harming in health sector impacts somebody's life, even to reach the point of death. Harming in the digital ecosystem is maybe somebody who will perhaps have his computer crashed. So there are two huge differences. So the question and what we trying to do with the private sector is to bring them to the table, first of all, to understand. Because if you go back before the pandemic, every gathering that we had, and the ones I attended, a number of them, if I was at a gathering organized by the United Nations or non-profit organization, the representation of private companies was less than 5%. If I went to a gathering that was organized by private companies, the representation of governments and non-profit organization was less than 5%. So we need to change that to make sure that we bring these two perspectives or two groups or multiple groups, including the academia and civil society, together to extract the best out of each one. Because we are good at convening at making sure that we provide norms and standards. Private sector is good at innovating. Academia is good at research. Civil society is good at ensuring that the issues that are impacting negatively civil society are brought to the fore. So we need the best out of each one of these sectors to really deliver that solution that we all can be proud of in the next generation and the next generations to come.
Yes, definitely. I would like to get to the point of digital transformation, which is also a part of your role by enhancing WHO's collective performance and efficiency to deliver the health for all goal, as we just discussed, in the Sustainable Development Goals. What are the biggest challenges to implementing innovative technologies within UN agencies?
The first big challenge is the fact that we are risk averse, especially in dealing with private sector. And there's a lot of innovation driven by the private sector. The second is the fact that we are slower from the UN perspective, from the humanitarian side, in moving through a solution. And private sector moves very fast. But we are slow for a reason, because we want to consider implications of ethics, privacy, and all other, I would say, potential harms. We want also to address equity. I can just give you an example. Today, the whole world is talking about vaccination passports, and the private sector is pushing to get the vaccination passports, or what we call it, vaccination certificates. We don't call them passport. It is a solution that will help bring back businesses such as the travel industry, tourism, and others. On the other hand, from the UN perspective, we look at the equity. How can you ask for a passport or a vaccination certificate of somebody from Mozambique? By the way, I'm from Mozambique, where there are only 400,000 vaccines delivered into a country with 26 million people. So the equity issue needs to be addressed. So therefore, when I said before, we need to bring the best out. If the private sector wants to see this issue of returning back to normal with the vaccine, but it needs to be combined with all the other public health measures, we need to also the help of the private sector, but also the other governments and funders to make sure that we address the equity issue. Vaccines have to be available to all countries, because if we wanted to truly address the challenge of COVID, the economic impact of COVID, we need to address it holistically. So the traditional partners that used to meet and discuss problems in the past, pre-pandemic, we need to rethink, because we need to bring the new ones, the new entities such as the private sector, to be part of that discussion and ensure that the solution is holistic, but also address all the concerns from both parties, and we are able to really drive that transformation to the success.
Thank you so much. We have been discussing about the role of private sector and innovation in health responds to unmet public needs by creating new ways to focus on vulnerable populations while aiming to add improved efficiency, quality, sustainability, and affordability. In what ways are you working with the partners and the private sector to turn this into reality? And what role does the private sector have in advancing this? The way we started working with private sector is, which is really enshrined with the framework of engagement with non-state actors, because that's where we can operate. After the pandemic, we basically put out a call to make sure that we get the support. We got great amount of support from private sector. Over, I think, 23 companies with over almost 50 work streams that were created. Of course, the challenge is when you talk about innovation,
innovation does not have evidence, right? So it's innovation, and we, so if you look at WHO is a scientific, normative, and evidence-based organization, right? So these three elements, they already puts us with some challenges when it comes to innovation, because there's no evidence. Now, what we decide to focus on, based on a number of discussions with a number of stakeholders, is to scale up innovation for impact. So those innovations that already passed a number of areas and groups like such as Canada Grand Challenge, Africa Grand Challenge, to see which ones have higher impact. We can, together with the private sector, invest. For instance, one of them was the innovation on oxygen delivery system using with solar panels, supported by solar panel, to really allow primary healthcare setups in very remote areas to be able to have oxygen delivery service. But it requires a lot of changes within the organization itself, because we have such challenges in dealing with private sector because of conflict of interest, because of the drive of profitability, where we're not there to profit. We are here to deliver digital public goods, or public goods in general, and meaning that countries do not have to pay for it, while the private sector is there to make profit. So we had to really navigate this very delicate line of ensuring that we interact with private sector, but also making sure that we stick to our core principles and the whole framework of engagement with non-state actors to deliver those public goods that is much needed by all states.
Thank you. You mentioned about innovation for impact. Definitely, I think those are very key words in today's world. But how do you envision, like, innovators or startups who are looking into innovative products, how they can interact with WHO? Is there kind of a platform, or what would be your kind of suggestion to them to proceed further?
Yeah, actually, the innovation strategy, we have two areas, right? One is internal innovation, because it's very good to talk about innovation, but it's important that your organization is innovative and actually embrace innovation. So you allow your workforce to actually innovate. We learned that from the private sector. So we have a whole initiative called Lead Innovation Challenge within WHO to bring the workforce innovators up to the fore, and then really support them with the innovations within WHO to support WHO delivering services, better services to all our beneficiaries. That's one area. The other area we working is to partner with the number of innovators, incubators, because our strength is not to create an incubation of innovation, because they are hundreds of them out there. So what we decided to focus our effort is to focus on those innovators those innovations that already went through that incubation, but are ripe to scale, because then that's where we can bring partnership to match supply and demand. So working with the countries, using our network of offices at country level to create the demand, and then you working with the incubators of innovations to bring the supply, and then match that, and then create that scale, and then have that impact. So if an innovator has an innovation idea, I would advise that to go through the Africa Grand Challenge, Canada Grand Challenge. I think Bill and Melinda Gates Challenge. They have a number of WFP Innovation Challenge. There are numbers of them that we work with, and we meet them regularly to look for those that we can scale up. And that's where we see our distinct advantage.
That is fantastic. And we would love to promote that route for the innovators and startups to follow, because at the moment in today's world, we are in the middle of a pandemic, still in the middle, I will call it. It is very important that innovators really work around health issues and really deliver for WHO, those innovations will really play an important role, hopefully, in the future for more resilient communities. Going back to the digital health, one specific issue that comes within the frame of digital health is, of course, mental health. And this is something that we as an organization are analyzing quite substantially. Global mental health has been very much a common topic of discussion during the pandemic. In what ways can digital health assist with innovating with regards to the global mental health?
I think we have two areas, and then we do have a whole mental health team. One is, first of all, let's acknowledge that only 45% of world population live in a country where there's one physician for every 100,000 people. Only 45%, which means that a lot of the part of 55% live in countries where there is the access to specialized care is a challenge. Let alone with the pandemic, the increase on mental health issues. There's some researches around that. It is exacerbated the whole issue that was already there before the pandemic. Now, we have a number of tools to support the basically to patients or to be patients or just individuals that we would like to, that we working with our mental health team. We have an M-Dementia program that really to support the dementia global action plan in reducing the risk of dementia and support the caregivers. But we're also working with countries such as India, government of India, to launch the apps such as M-Yoga app, to bring this element, a number of tools that are directed towards the individual. But let's not forget that we also have the need to increase the specialist access to specialists, where the telehealth and telemedicine plays a role. So in that front, we are working with a number of governments to drive that. We work together with the G20 presidency, Saudi presidency on that. Now we are working on G7, the UK presidency to really address this digital health capacity and opportunity to enhance areas such as mental health, which would greatly benefit from that. Of course, we also have our traditional services such as handbook, and we are also digitalizing the whole guidance to ensure that access to those guidance is easy for the part of the population that is connected to broadband, but also for those that are in remote areas. We're working with a number of countries to create this country support mechanism to bring these populations in those remote areas to really address the mental health issues, which have tremendous, huge consequences at every level of society.
Yes, definitely. There are so many things to be done, and it's great that you are working on a government level as well at WHO. Going a bit slightly off topic, I would like to bring up a question about misinformation. It has been something we have discussed with different senior UN officials as well, including Melissa Fleming in our New York Digital Summit for WHF. And we have spoken largely about issues such as vaccine hesitancy and misinformation. Clearly, in your role as Chief Information Officer for WHO, misinformation regarding the organization has proliferated since the start of the pandemic. How have you and your team aimed to innovate in this area?
Indeed, 2020 has been a year where WHO was in the news for many times for good reasons, but sometimes we're not so good news about WHO, and then some of it was perceived, and misinformation was it scaled up substantially. In 2019, late 2019, Dr. Tedros asked the team of WHO colleagues to meet the tech giants and to discuss how we could work together. And when we went there, one of the issues was vaccine hesitancy before COVID. And during that period, the meeting was actually, I can disclose, was Facebook. And we say, look, your platform is proliferating mass vaccine hesitancy and misinformation. And their response was, look, we put a platform and then the information, people start putting information. So why don't you add your information? As a result of that, of course, with the pandemic, we had to accelerate first of all, create a whole new area of epidemiology to address the infodemics, but also to work in three areas. One, raise WHO content. So we signed an agreement with Facebook to say accurate information from trusted sources, where WHO is one of them, on COVID has to be prioritized. We work with Google, say somebody search COVID in Google, they should land in WHO information or government information, so not just the one that is mostly hit, or not just the one. So we asked all the platform owners to play a role to ensure that accurate information is available as a first choices in those platforms. We also start fighting with the misinformation. So one is to have accurate information, the other one is to fight misinformation. So we create a myth buster. As soon as we see we have an analytical tool that see that there is a misinformation on one topic, we then quickly address that. So we have to be proactive. Before we just passive saying, okay, we put the information on our website, we hope for the best. That doesn't work. And the third, we say, if you want to fight misinformation, you cannot just fight misinformation in one channel when the misinformation is happening in a different channel. So we need to go to the channels where that misinformation is happening. So we created this multi-channel team that really look at all those that are amplifying information to disseminate accurate information, but also to run those myth busters to ensure that accurate information is there on Twitter, on Google, on WhatsApp, in all types of social media platforms. So we have a team of a multidisciplinary team of WHO working in those areas. But we also brought together scientists and specialists to talk about infodemics, and then we created 6 work streams on science, health, media, the UN role, the tech platforms, and the civil society to see what measures, what actions each one of these areas can do to really address this topic and ensure that lives are not lost, people are not harmed just because of misinformation.
Thank you so much for your message. It is definitely very important these days. Infodemic is something that we should avoid as much as possible. And it's great that you have already taken actions on that. Thank you so much, Bernardo, for being part of the WHF Talks Live. It has been a great and stimulating conversation. I would like to ask your message to the audience today, your final and closing remarks.
My final and closing remark is something that is very close to WHF in terms of the togetherness. Together, let's bring the best out of each one of us to deliver those positive health outcomes we all want to see, to deliver the sustainable development goals that we all want to see. The together means you and me and all of us individually, but together also means collectively our entities that we represent, organizations. Myself and the WHO in general, we will bring the best out of us into the table to join forces with the best out of each entity to really deliver that positive outcome. let's ensure we are inclusive and address these equity issues I just mentioned, be it on vaccines, be it on tests, be it on any other area. Let's take the partnership and collaboration to a new level. Not one pre-pandemic, a new level that will really leverage on the expertise, knowledge, capacities of each one of us. So together, we can beat this SARS-CoV-2 virus and all its variants. But we need to win not just the battle of one national government that is winning that battle. We need to win the whole war of COVID-19 to get out of this pandemic together. Because one nation winning the pandemic does not end the pandemic. So together, let's learn, prepare for a better future. So together is the key word. Thank you.
Thank you so much, Bernardo. It has been an amazing conversation, and I'm sure the audience will benefit from this greatly. And really looking forward to the next one. I think it hasn't just been enough. There's so much more to ask you, but I don't want to take too much time of yours at the moment. I know there are certain pressures, as we all know. So thank you so much for being part of this.
It's been a pleasure. Thank you very much. And thank you. Let's do it.
Exactly. Let's do it all together.
Yes.
Thank you so much.
Thank you.
Have a lovely rest of the day.
You too. Thank you.